ahead. All right, well, welcome everyone. This is the second of our fall advocacy sessions that we're doing today to give you an update on how to advocate, some of the things that DSF is advocating for, and what's important to our community. So I'm excited to share with you guys. I do want to point out that we have some wonderful sponsors for our legislative advocacy program. Both Jazz Pharmaceuticals and UCB contribute financially in order to help us be able to do all of the advocacy things that we do. So awareness, right? I think most of you on this call are pretty big about spreading awareness already. You'll see that it's right there in the mission statement for DSF, increase awareness. And that really is a big part of engaging in advocacy, because the more we share with the people around us about Dravet syndrome, the easier it makes us able to advocate and for them to understand the why behind what we are advocating for. So I'm not going to go through this whole list, but here's just a few examples of ways that you can spread awareness. There's a lot of great stuff on the DSF website, such as resources you can share with other people. We have both patient and caregiver stories on the website. We're pretty active on social media, so you can share posts from DSF or even create your own content and share, which is a great way to increase awareness of Dravet syndrome. So we all have a story, right? Whether we're a parent or a grandparent, whether we're new to this journey or whether we've been doing this for decades, we all have a story to tell about our experience with Dravet syndrome. And being able to share about that is a big piece of advocacy, because if you're trying to advocate for something, the person you're speaking to needs to understand the why this is so important to you and what it means to your family. So if you'd like to learn more about how to tell your story, we actually have a couple of webinars that are out on the DSF YouTube page that you'll see down there below. So those are great resources if maybe you're not super comfortable with sharing and you would like to get some pointers for how to do that. So what is advocacy? Unfortunately, when you get thrown into the world of Dravet syndrome, we're kind of all forced to be advocates, whether we want to or not. Oftentimes, things that we think should just be a given and should come easily end up being a challenge, and we have to fight for everything, whether it's school or insurance. There's always some battle to fight, and there are always things that we can advocate for to make the situation better for our families. So the obvious areas for advocacy are the bottom two, right? State and federal, because we know that we have legislators that are making laws that can impact us. But there's really a lot of other things that are on a much more local level that we can be involved in too. The first, for any of us that already have kids that are school age, we know that school can be such a challenge, and we often have to advocate for our kids, first and foremost, just to get the rights that they are entitled to by law. Not all schools are providing what they should. Sometimes just lack of wanting to, and sometimes it's just a resources issue that maybe they want to help, but they just don't have the resources and funds available. So unfortunately, we do have to get involved a lot with school. One example of this is in my own family is oftentimes at the beginning of the year, my daughter ends up in a classroom where there may not be enough support. It's too many kids, not enough teachers. And this is where, the teachers can complain all they want to the principal or to the district. They may not get the support. If a parent complains, that can truly make a difference. And sometimes I've reached out to either a principal or like our special education district staff just to say, hey, do you know what's going on in this classroom? Or, they need additional support. And sometimes it's resulted in the district allotting another parapro position so that there would be additional staff to help in the class. So those are the kind of things that not only are we advocating for our own child's education, but we're actually improving the situation for the other kids in the class as well. Insurance is another big one, right? Most of us have probably gone through a prescription request getting denied for whatever reason. So my biggest pointer here would be don't automatically accept a denial is the final no. I saw some statistic recently that I think was like 75% of insurance claims that are denied, when they get appealed, they get overturned and they do get approved. And so don't just assume that because you got a letter in the mail or an email or the pharmacy says, oh, sorry, it was denied. Don't just assume that that's the final answer. You really do have the ability to advocate in order to ensure that your child gets what they need. Hospital healthcare provider policies. I mean, there could be something that is making things difficult for your family in terms of seeing your provider. Local businesses, maybe a restaurant that you like to go to isn't very wheelchair accessible, and so you reach out to them about that. Other local issues and regulations. The main example I use for this is my daughter in her high school a couple years ago, when she had a seizure, they called for an ambulance and it took 30 minutes for the ambulance to get there. That is obviously not acceptable. And so like the first thing I did when I got home is I emailed like my city council person, the city council person for the school district, as well as the mayor of our city, because they're the ones that maintain the contract for the ambulance company. So if the city is contracting an ambulance company, they're expecting a certain level of service. And so I felt, since we'd had such a terrible experience, they don't know that that's happening if one of their constituents doesn't reach out and let them know that that happened. And so I got a great response, like right away. They reached out to the ambulance company, and hopefully as a result, they're more aware. And the next time something happens at that school or anywhere else in our city, it won't take so long for somebody to get an ambulance. So and then the state and federal things, which we will go into a little bit more, but those are the more obvious things that, we hear about on the news, about legislation and policies that are changing that can impact us. So we are fortunate to have an amazing community of families that have been involved in a lot of advocacy on their own. The bottom left picture is Casey Capps and her family when they were at a bill signing in Missouri for Will's Law, which is named after her son, Will, for seizure-safe schools. This is an effort that has passed, I think, in about half the states in the US. The seizure-safe school laws, typically what they're doing is just putting it in law that anyone that works with a child that has seizures in the school needs to be properly trained. So even if it's just a speech therapist that may only be with your child for 30 minutes a week, they need to have formal training so that they would know what to do in the event of a seizure. And so this legislation is something that like Epilepsy Foundation and Epilepsy Alliance America have been involved in. So if you'd like to get involved in your state or see if your state may already have a similar law, that's a great place to start. Many of our families were involved in efforts to pass medical cannabis legislation in a lot of the states in the US. My own family in Georgia, several others were deeply involved in their states. And this is little Amanda Hauser from New York at the bill signing with Governor Cuomo. She is now all grown up. So this picture is kind of old, but I just love this picture because it just shows the excitement in her eyes and, what a difference that it made for all the people that were there. And then we have several from DSF staff and board that attend Rare Disease Week in Washington, D.C. And we're excited this year to hopefully get some other members of the community to join us. So it's definitely something I'd like to talk to you about more if you are interested. And I'll talk about that a little bit more further in the presentation. So, I mean, this is just a few examples of things that families in our community have done in the past, but it's really exciting to see the efforts from people that, when something happens that impacts their family, they decide to reach out and try to make a difference and make their voice heard. This is just a list of a few. The first list is just some different terms and things to be familiar with. And then I've listed out a lot of the different organizations that we at DSF partner with. Obviously, epilepsy organizations that we stay in close tune with the kinds of things that they're advocating for, but then also rare disease organizations like Every Life Foundation, because we're kind of in this unique situation where Dravet syndrome is epilepsy, but we're also a rare disease. And so we don't completely fit into either of those buckets. So we really try to stay plugged into what all of those organizations are advocating for. And then we also have relationships with a lot of these other advocacy organizations that are listed here. We often sometimes they will send a letter to members of Congress about a specific policy or asking for support of a piece of legislation. And so whenever we get requests to sign on, we always look at what the legislation is for, what they're asking for, and then often we will sign DSF onto that letter because, you know, when a letter is being sent to say it's being sent to Speaker Mike Johnson or Majority Leader Thune in the Senate, we did one this week that was to CMS Director Dr. Oz. Like anytime an organization is sending a letter, the more other organizations have joined in on that letter, the bigger impact it makes because it shows them, hey, this isn't just a one-off thing that these people are asking for. A lot of people think this is important. So we try to stay plugged in and engage as much as we can on those kinds of efforts. And then at the bottom, I mentioned parent to parent and the ARC. They have typically state chapters, which can be really, really helpful. Say you're having an issue with Medicaid or something that's more local to your state. Oftentimes they have websites with, they may have webinars available or they may have staff that can help you if you're having issues that you need help with that are more specific to your state. So I'm not going to go into like a huge government 101. Hopefully some of us remember our middle school government lessons that we may have had. But the important thing to know is that we have people that represent us at all of these different levels. There are people typically that are elected that their job is to represent us and listen to us. So, you know, at the local level, starting with school, you will have a school board member. It could be based on your physical address where you live, or it could be based on which school your child attends. And then those board members all roll up to a superintendent. And so sometimes if you're not getting the support you need from within your school, either the teachers or administrators, sometimes it makes sense to go to the school board, whether it's just sending them an email and saying, hey, I want you to know about this. Can you help me? Or whether it's actually showing up at a school board meeting and speaking during public comment so that lots of people hear about it. Those things can be very effective. And then for both city and county, similar setups, but like I mentioned with the ambulance issue, right? I have a city council representative and then a mayor. And so those were the people I reached out to about that particular issue. And then at the state level, we have each a representative and a senator in our state. Sometimes the names for those can be a little different. Like I know in some states, representatives are referred to as delegates or something else, but you typically will have one of each of those. And then the senators' districts are a little bit bigger. So oftentimes it may be a little easier to get in touch with your representative than your senator, but regardless, they are there to support you. And really and truly, if you're having issues with something like Medicaid, reach out to their offices because they do have the ability to intervene. They can't always change things, but sometimes if you're just not getting a response and, you know, maybe you have an appeal or something's not happening, sometimes all it can take is a call from that member of your state legislature, and then suddenly things will start happening. So don't be afraid to use those people and their staff if you need their help. And then likewise at the federal level, there are 435 members of the House when it is fully populated. I know there's a few vacant seats right now. And so the state population determines how many representatives there are from each state. And then each state has 2 senators. And so they are responsible for the entire state. So you can always reach out to either of your senators if you have anything that you need help with. So how do you reach out? There's a lot of ways that you can get in contact with these people. So you can typically they'll have a website, like whether it's their official legislative page or like a campaign website that they may have set up on their own. There's usually a contact form that they can that you can fill out. You can typically email them if you can find an email address. Sometimes there's an email function built into their website. Typically, when you do that, the actual legislator is not going to be the one looking at it because they're literally getting tens, if not thousands, of emails and messages a day, depending on their role. And so it probably will be a junior staff member, possibly a college intern that is looking at those messages. But they do keep track. So if you're contacting them about a specific piece of legislation, they are keeping track of how many messages they get in support of it and how many messages they get against it. It doesn't mean that it will change how they vote, but they certainly use those messages to keep a pulse on what their constituency is feeling about a particular issue or piece of legislation. You can call their office. Same thing, you're not going to get to talk to them. You're going to talk to probably a very junior staffer who's tasked with answering the phone. But again, they do keep track of the messages that they receive. You can ask to have a meeting. Typically, it's going to be with a staffer, not the member. At the state level, you never know. Depending on why you're reaching out, you may be able to get a meeting directly with the legislator right off the bat. But typically, even then, it's probably likely that you would meet with a staff member first, and then they might set you up with a meeting with the legislator. In terms of Congress, it is very difficult to have a meeting directly with the member of Congress. As many times as I've been to DC and advocating and things, there's only been a couple of times where the actual member of Congress was in the meeting with us. But forming that connection with their staff is honestly just as impactful as meeting directly with them, because they may have more time with you and can really spend the time getting to know you and listening to your story and understanding what's important. And then they can go back to their boss and say, hey, I met with this family in our district. I'd like to tell you about them. This is what's important to them. I really hope that you'll support this. So sometimes those connections can be just as effective as if you actually met with the member themselves. Another thing that can be effective is just following their social media. A lot of them are very active on social media. Sometimes they don't allow comments because they don't want people to be able to say bad things. But if you have the ability to comment, if one of your legislators, again, this applies to state level and federal level, if they support something that helps you, comment and say, thank you so much for your support of this. It means a lot to me because of my family. Likewise, if they are against something that would help you, or if they're supporting something that is bad for you, let them know that as well. The last thing they want is people commenting on their social media and saying, I really wish you hadn't have done that because I have a medically fragile child and you're hurting my child, and that kind of thing. Again, they're not always going to let you make comments, but if you have the ability to utilize that, it can be very effective, because not only is the member and their staff getting a pulse on what their constituents feel, but other people in your area, other constituents, are seeing the things that you're saying, and you could end up helping to change their minds about something when they realize the impact that it could be having on families like ours. And then town hall meetings, that's kind of a thing of the past. It seems like since things have gotten so politicized, a lot of, especially members of Congress, are not really having a whole lot of town hall meetings because they don't want to have to answer the questions and deal with people face to face. But that is something that if it's happening either in person or a virtual town hall meeting, that can be a good opportunity to get your voice heard. So these are just a few ways to get involved. I mentioned the seizure safe schools. If that's something that you would like to get involved in, because your state does not already have a law in place, let me know. And I'm sure I could probably connect you with some people in your state that might be either already working on it or interested in working on it. Attending advocacy events. I know here in Georgia, there's a lot of different groups that will have kind of like a lobby day at our Capitol during the legislative session for different causes. And so if there's something that you're interested in getting involved in, whether it's a school issue or a Medicaid issue or something like that, if you connect with those local organizations, sometimes they make it really easy by setting up those lobby days. And then I mentioned Rare Disease Week in February. We will have a few of us on staff there again, and we're really excited to hopefully get some other members of the community to join us this year. And then Every Life Foundation, who sponsors that event, also does a virtual version of it in August for people that can't travel to DC. They provide the ability to meet with congressional staff either virtually or in their local district office. One of the things that was very exciting this year is we had a lot more families get involved with requesting proclamations for Dravet Syndrome Awareness Day on June 23rd. So we had, I think, maybe 5 or 6 different proclamations that were received at city or county levels. And then we actually, for the first time, had a state level proclamation in Pennsylvania this year, which was pretty exciting to get to be have Dravet Syndrome Awareness Day recognized by a state. Typically, when you do that, you just reach out to them, whoever your legislator is, and ask for their support, and they can get it through the process if they're willing. And then sometimes they'll have like a photo op, and they'll have you come and talk, and you get to share a little bit about Dravet syndrome. And so it's kind of a neat thing just to help spread awareness. And then, like I said, just reaching out to your members of Congress or your state legislators about a specific issue is another great way to get involved. So there's no shortage of bills in Congress right now that impact healthcare and other things that related to the disability community. So I'm going to mention a few of these that are things that we as an organization have been advocating for, and that when we go participate in Hill Days in Washington with different organizations, these first couple are typically at the top of their priority list as well. Even if you, as I talk about these, if you think, well, maybe these don't apply to my family, or, you know, this isn't really going to help my child, keep in mind that even just going and meeting with your legislators and asking for the support of one of these pieces of legislation, it just gives you the window to have a conversation with them about your family and about what's important to you in terms of access to medications and Medicaid and different things, research funding. And so it's really a great opportunity just to kind of share with them about who your family is. So the first one is called Accelerating Kids' Access to Care. A lot of us have seen a Dravet specialist, which may be out of state. So if we have private insurance, that's usually not a problem. Typically, that doctor can accept our private insurance across state lines, and it's not a problem. However, if our child's only insurance is Medicaid, then we can only see a doctor out of state if the Medicaid provider, if that provider is enrolled in Medicaid in our state. And that's where it gets challenging, because not all doctors are enrolled in Medicaid in all 50 states. And so we oftentimes what we see is a doctor may be enrolled in Medicaid for the states that are surrounding them. So like I live in Georgia, so doctors in Atlanta probably are enrolled in Medicaid for like Alabama, Tennessee, Kentucky, Florida, South Carolina, because they get patients and families that come from there. But if someone from, you know, say Utah wanted to come to Georgia to see a doctor, more than likely Georgia's not going to take Utah Medicaid. And so what this would do is basically set up an infrastructure that makes it much easier for a doctor to enroll in Medicaid from other states. So instead of having to renew every year, it would be every 5 years, and it would just streamline the process so that it's not like they're having to literally go complete an application for every single state that they would like to see patients from. So it would just make it more streamlined and easy for our kids to see providers in other states. And then Give Kids a Chance Act, what this would do is extend the Rare Pediatric Priority Review Voucher Program. What that is a program that has been around for over 10 years that helps encourage the development of new treatments for diseases that impact rare pediatric diseases. So the program exists, unfortunately has a sunset clause in it, and some of it just sunset in September, and then the rest of it will completely go away if this program does not get renewed. This doesn't seem like something that would be all that important to us, but in reality it is, because we're a small community and we want companies to have the incentive to develop treatments for Dravet syndrome versus go develop a treatment for, you know, say diabetes or heart disease or something else that impacts a much larger population of people. And so the way that this voucher works is that a company that gets an approval for a rare pediatric treatment will then receive a voucher that they can use either for a future drug in development, or they can turn around and sell it. And what that voucher does, it gives expedited FDA approval timeline. So instead of like the normal 10 months for approval, it would potentially be 4 months. And so that's very valuable to a company that's gone through all of the research and development and clinical trials. And if they're that close to getting the drug to market, this voucher can really help that happen faster. This actually was awarded to one of the companies that developed a drug for Dravet syndrome. So GW Pharmaceuticals, when they were bringing Epidiolex to market after approval, they received this voucher as a result of developing a rare pediatric treatment. And then they were able to turn around and sell that voucher. And when I say sell it, I mean millions of dollars. And so when a company has that option to either use it for another treatment or sell it to get capital to help them ultimately bring the drug to market. So this is a very valuable program that we keep hearing over and over again. It really does provide incentive for companies to invest in rare pediatric diseases. I do want to point out that both of these things have really broad bipartisan support. There's nothing political about either of these pieces of legislation. Equal number of Republicans and Democrats have signed on. They were actually both included at the end of 2024 in the final year-end package that was attempted to be passed in December of last year. And then you may remember the infamous tweet from Elon Musk where he basically said, strip everything out and only pass the bare minimum. And so these pieces of legislation were both casualties of that tweet and ultimately did not move forward, even though they had broad support. They also have both been included in some legislation this year as well. So we really do hope that at some point when Congress can actually get budgets passed and start getting down to doing the normal work that they should be doing, that we hope that both of these will get brought up and will hopefully become law at some point. The next one is the National Plan for Epilepsy. So there are a lot of other disorders that have a national plan in place. I think Parkinson's was one of the main ones. And so the idea behind this is just that there would be a plan in place for people with epilepsy where it gets all the different doctors and treatment centers on the same page, and just ensuring that everybody's getting the best care possible for epilepsy. So this was newly introduced last year, and we do hope that this is something that can move forward at some point. Gloria Rodriguez, who's on our DSF staff, and myself both served on work groups for this recently to help provide input into what this plan would actually look like if it were to eventually become a real thing. Safe Step Act. So a lot of us have probably experienced our doctor writing a prescription for us to try a medication, and we're all excited because we're going to try this med and maybe this will be the one that works. It gets sent to the pharmacy, and then the pharmacy tells you that insurance denied it. And then you start looking into it and you find out it's because they said, well, before you can try this medication, you have to have failed this medication or potentially multiple medications. Essentially, they want you to try the older, cheaper medications first. And then once you've gone through all those, if those don't work, okay, now we'll pay for the newer, more expensive medication. We know as parents that can be very frustrating, right? Because our doctor tells us they want us to try this medication, and sometimes insurance is the barrier to that. So this wouldn't necessarily eliminate that, but it puts in, my understanding is a better appeal process and just makes it easier without having to jump through so many hoops so that you can ultimately have access to that medication. The Connect for Health Act is related to the telehealth that became a big thing during COVID. Obviously, people didn't want to go to the doctor, and so telehealth became a very viable option for a lot of us to continue to see our doctors. Unfortunately, it is just a temporary program that was put in place, They've extended it some already, but I think it's expected to sunset at some point. And so not only would this extend the telehealth option, but it also would increase some of the different ways and remove some of the limitations for situations where you're allowed to use telehealth. This is very important for any of us that want to see a Dravet specialist out of state, because as long as we have telehealth as an option, we have the ability to maybe only have to travel to that specialist once a year, and then, every 3 or 4 months, just do a virtual visit via telehealth, which obviously saves a lot of time and money for our families. And then this last one is related to copay accumulators. It's a very complicated thing to explain, but I'll use the medication stiripentol as an example. We get it from a specialty pharmacy. Many of us that are on stiripentol probably are using the manufacturer's copay card, so that we're paying maybe only $25 a month, or maybe even zero for each monthly copay. And so it's about whether that counts to our deductible or not. So the insurance company is getting money from the manufacturer that they're paying on our behalf. So the insurance company is getting paid from them. If they don't count that money that they're receiving from the manufacturer towards our deductible, then we're still having to meet our deductible, which essentially means the insurance company is getting paid twice. They're double dipping. They're getting paid from the manufacturer, and then we're still having to meet our deductible, not on that medication, but we're having to meet it on something else that we have claims for. So I think about half the states now have banned these copay accumulators. And so because of that, it now has become a more widespread federal issue, where people are saying, hey, why is this a state level thing? We should ban these completely everywhere, so that the insurance companies can't continue this double dipping. And then these are just other areas of concern that aren't necessarily related to a specific piece of legislation that's around. But as we all know, Congress has been a little bit of a mess this year. A lot of fighting and a lot of cuts and things that we weren't necessarily expecting. So the first was shortly after the new administration took effect, there were some pretty drastic and immediate cuts to research funding. At one point, NIH funding was expected to be cut by 90%. One day, I think like in April, the entire staff of the epilepsy program at the CDC was let go, like just on a whim. You're gone, your jobs are gone. I think that they've been brought back, at least some of them. And the funding cuts have thankfully not ended up being quite as steep, but honestly, a lot of that is still held up in court cases. And so I don't know that anything is totally resolved in terms of research funding. I know a lot of us make the assumption that because DSF funds so much research, thanks to the support of our community, that we don't really depend on federal funding. But that's actually not the case at all. Typically what happens is a DSF research grant for a small amount may just get a researcher started on a project. And then depending on the outcome of that research project that they do from DSF, then they can turn around and go to the NIH or other federal sources and get much more significant funding. So we call it kind of like the seed grants. We provide the seed grants to get them started, and then ultimately they get federal funding. At one point earlier this year, Veronica Hood, our scientific officer, wrote a great blog about this, where she showed just how much funding has been given for Dravet syndrome research every year. And you look at how we've done $12.5 million of research over 16 years. There were a couple of years where just in 1 year, we got almost that much Dravet research funding in 1 year. So that funding is really critical to our community. Medicaid. HR 1, otherwise known as the Big Beautiful Bill, that passed this summer. One of the big components of that legislation was cutting $1 trillion from Medicaid over the next 10 years. Obviously, that's a pretty significant impact. And the way that they planned it out, a lot of the changes are happening gradually over the next few years, very conveniently, the biggest changes that people are likely to feel the impact on will happen after the 2026 midterm elections. So that a lot of the pain, people won't realize that some of these cuts are going to impact them until after this next election cycle has passed. We know that the Republicans will say that the cuts to Medicaid aren't intended to take coverage away from the people who truly need it. It's all about cutting fraud and abuse. And I think most of us would agree, like, yes, cut fraud and abuse, right? But we don't want our community to be an unintended consequence of that. So the way Medicaid works is that it is a federal program, but it is run by the states. So each state gets a certain number of dollars from the federal government, and then they provide funding of their own too. And then they set their budgets and figure out how to run their Medicaid program in the state based on that budget. So a lot of our community depends on waiver programs. So one example of a waiver program is what's often called Katie Beckett. It may be called something different in your state. That is the waiver program that allows a child with a medical condition to qualify for Medicaid coverage regardless of the parent's income. So it's truly based on the needs of the child, regardless of how much money the parents make. Another type of program that are waivers that a lot of our community use is like nursing care or respite care or day programs and things like that for adults that have transitioned out of school. And so all of these waiver programs, unfortunately, are optional. There's nothing in federal law that says that the states have to continue these waiver programs. And that's one of the big reasons why the programs vary so much from state to state. Some states provide really great coverage and service to their families, and other states not so much, because it really and truly is up to the state to administer that. So obviously, we don't know what's going to happen at the state level with all these Medicaid programs that are out there, but it is a very valid concern that some of these waiver programs may be the first things to get cut because they are optional, and it's an easy thing for them to either eliminate or just reduce the amount of slots or the amount of dollars that are allocated to each participant in it. So it's definitely a serious concern as to what will happen to Medicaid. And then, as you've probably heard in all the talk in the news lately about the budget reconciliation process, the big sticking point for the Democrats was that the health insurance premium subsidies that are there for anyone that is using marketplace insurance, which otherwise known as Affordable Care Act or Obamacare, for the people that are relying on that for their insurance. In the past, they were having those premiums subsidized. Now, those subsidies are going to go away. And I know, I mean, even just me personally, a couple of friends that I have that were paying like $1,000 a month for their premiums, which already is a lot of money to be paying monthly for insurance. Their premiums are going up to like $3,000 or $4,000 a month. And that's just not something that the average person can handle. So even if maybe your family isn't relying on these insurance plans, it can just have a drastic overall effect on the healthcare industry because hospitals are going to struggle. There's a big concern that a lot of rural hospitals will end up closing. It puts more pressure on insurance for those of us that do have insurance, because the likelihood is a lot of people that if they're an otherwise average healthy American, they're probably just going to decide to forego insurance next year and take their chances and not actually have insurance, which could end up hurting the rest of us that really do rely on our insurance. And then you've probably heard that the ultimate goal is to get rid of the Department of Education completely, with the intent of returning it back to the states. Again, education is something that is run at the state level. Just like with Medicaid, some states do a better job than others in terms of the funding and the resources that are provided for education. The biggest concern for our community would be that right now, it's the Department of Education is who that's who's basically the watchdog to ensure that states and even down at the local district and school level are giving our students with disabilities what they are legally required to in terms of an education. And so if something is happening where your school district isn't doing something right, you can always go to the Department of Education and file a complaint, and they can get involved and ensure that your child is getting what they're legally required to. And so it's just kind of a scary idea that if the Department of Education and that oversight goes away, it will make it easier for the states to cut corners and not provide the services that our children are required by law to receive. So if you're interested in looking up a specific bill in Congress to see like kind of what the status is, if your members of Congress have signed on, you can go to congress.gov, and it's really easy. Either type the bill number or the name of the bill in the search window and pull up that information so that you can see who may have signed on to it. And then Congress has something called caucuses. So the point of a caucus is basically just getting people together based on a common interest. So you'll see here, there's an epilepsy caucus that was new last year. The rare disease caucus has been around for a while, and literally in Congress, there is a caucus for everything you could possibly imagine. It's not just a healthcare thing. It's like every industry. There's a beef caucus. It's crazy. And any little thing you can think of, there is a caucus. And so the idea would be, using the National Plan for Epilepsy legislation as an example, their prime target to get support for that would be the Epilepsy Caucus, because the people that have joined on as members of the Epilepsy Caucus have already expressed that they have an interest in supporting things related to epilepsy. And so the idea with these caucuses is just that you've got a group of like-minded bipartisan legislators that are willing to get in the room and talk about issues. I've sat in on a couple of the meetings of the Rare Disease Caucus, and so it's nice just to see that you've got Republicans and Democrats and higher positions within the House and the Senate that are a part of these groups and working together to try to help our communities. So you certainly could call your House member and your senators and say, hey, would you join this caucus? They may not, because they may not feel like they have a vested interest in epilepsy, but you never know. Like if your family's story touches them enough, they may say, you know what, I want to get involved in this. Or maybe they know somebody else with epilepsy, and that's enough too to encourage them to join. So I mentioned that you can reach out to members of Congress if you you can just do like a general reach out, but if there's a specific piece of legislation that you would like to contact them about, usually there will be action alerts set up by some organization that you can use. So you don't have to know exactly what to say, exactly what to ask for. So these are a few of the organizations with links to their websites where they have their action alerts. Often this is what we use that we link to for DSF to say, hey, if it's something related to a specific piece of legislation that we know one of these organizations is advocating for. And when you go to the action alert, you click on it, you enter your name and your address, and then it knows based on your address who your members of Congress are. And it will pop up their names and it will populate the form to send to them. So you don't have to look up their contact information to figure out how to do it. It puts kind of a form message in there, like, I would like you to support this piece of legislation because blah, blah, blah. You can edit it, you can change it. If you want to make it simpler, you can. If you want to add more, you can. And then there's always a section for you to add your personal story and explain why this is important to you. So these alerts make it really easy to reach out to a member of Congress when you might feel like you don't know what to say, but you really don't have to because it helps provide the information for you. So ways to engage, I just mentioned that on the DSF website, we now have a special page dedicated just to advocacy. That's advocatefordrevet.org. You can get to it on the website under the Get Involved menu, but you can always go directly to advocatefordrevet.org. And then we have links for a lot of the things that I talked about tonight with action alerts where you can reach out to your members of Congress. A few of them we do need to update because the status has changed a little since the last, so we'll get those updated soon. But you can definitely see the information there about all the things, most of the things that I mentioned tonight. We do try to post the most urgent calls to action. We'll post on our public social media to try to get people engaged. For those of you that are in our private parent support group, sometimes I'll put stuff in there as well. We try not to bombard people with too many requests in either of those spaces, just because we don't want it to constantly be us asking for people to, click on this link, do this, reach out to this person. But we do, when it's something that's really urgent, we will try to share the information to get people to get involved. And then I mentioned some of those other organizations. Follow them on social media. Every Life Foundation, Epilepsy Foundation, all of the ones listed here are great about sharing what's going on and how to get involved, and when there really is something that we need to take action on. And then I mentioned Rare Disease Week in February. So we would love to have any of you join if you are able. We're looking into options to see if DSF might be able to provide any support to help financially for families to come. So we've not gotten that worked out yet, but if you're interested in coming, please let me know, because we will do everything we can to make sure that anybody that would like to come participate has the ability to do that. The way that works is it's like a 3-day thing where the first day is just like learning about how to share your story and a happy hour in the evening. And then the second day is really when they get into, this is the legislation we're advocating for, understanding it. So it's a lot of the same things that I just talked about, but understanding it in greater detail so that you can feel a little more confident having a conversation with a staffer about it. And then on the third day is when they turn us loose on Capitol Hill, and they have meetings set up for us with the congressional offices for the members that represent us. And so the important thing is you will never have to go alone. There are always, we're put in groups, so you will always be with other people, so you don't feel like you have to be the one to know what to say. And usually we meet beforehand and everybody kind of decides like, okay, I'm going to ask for this, or I just going to introduce myself and that's it. And work together as a team to share stories. And those meetings can be very impactful with their staff. And then, as I mentioned, just reaching out to your state or federal legislators to tell them about your child, even if you're not asking for them to support a specific bill, even just saying, hey, I want you to remember my child when you're voting on anything that might make cuts to Medicaid. You need to know about why this is important to my family. So don't be afraid to reach out to any of your legislators and just say, hey, I want to tell you about my child. As I mentioned, I'm here to help, right? If this is something you want to get more involved in, if you have a question about any of these pieces of legislation, or maybe something that's going on at your state level that you heard about on the news or whatever, and you'd like to learn more, please feel free to reach out to me at any time, and I would be happy to help in whatever way that I can. Sometimes it can be frustrating, you send an email and you don't get a response, or you get just a standard like form letter response that shows that they really did not even understand what you were asking for, or you have a meeting and you feel like, they weren't really listening, or it's not, nothing's going to happen as a result of that. And that may be the case in those situations, but collectively, all of those messages and phone calls and meetings, like collectively, those things really do make a difference. And there is an impact when all of us raise our voices and ensure that we are advocating for our families. So again, I want to thank Jazz and UCB for sponsoring our program so that we're able to be such an active participant in advocacy. And with that, I'm going to stop the recording.